Hello there. My name is Julie Hirschberg, and joining you live this lovely Friday to share some great insights from our course last night on the latest in our understanding of functional movement disorders. And I thought I would add in a little extra here today to share a couple of slides from our course. Now, of course, I'm not going to do a whole 90-minute course today, probably just a couple minutes here. But the slides were so good. Thank you, Chelsea Richardson, Brittany Charlet, one of our great Re+active team members, for helping with some of these slides and putting together some of these great pie charts. So let me set us up before I dive into some of this. We are obsessed with functional movement disorders at Re+active, and a big part of this is that we see people every week that have come to us and they've said, nobody understands this disorder, or I've been misunderstood for 10 years, 5 years, and I've lost that part of my life. And how is it that you're the first person that seems to understand this? And that is so frustrating. People should not have to go through years of time to get a diagnosis and to come across the healthcare provider that understands it. So it has been our mission at Re+active to keep sharing with other healthcare professionals about functional movement disorders. So this month in our education, in our mini courses for our fellowship, in our Brain Bites, we are covering functional movement disorders and doing a lot in this area. So today I wanted to update you on some really cool things that I found by looking at a lot of the literature and attending courses and things like that in the pathophysiology of functional movement disorders and how that works with a pie chart. So I wanted to give you this pie chart to look at how we might set up assessment and treatment in a really complex case. And then finally, revisit our river runneth over analogy. It's one of my favorite things. And we have it in our slides. So that's why I'm here sharing a couple of our slides from today, because it's really, really helpful in a functional movement disorder, a lot of other disorders as well. I love this one. So first of all, if you're new to this, what is a functional movement disorder? So a functional movement disorder is a movement disorder. Involuntary, unusual movements. It is characterized by involuntary, but a learned, so there's a motor learning problem here, habitual movement pattern that is driven by abnormal self-directed attention. What is really important about it is that it doesn't seem to be due to an isolated structural lesion in the brain, but as we'll talk about in pathophysiology, but overall function or connectivity between different areas of the nervous system. Now, it may manifest several different ways. It could look like tremor, it could look like dystonia, it could look like weakness, it could look like a gait disorder. So many different patterns of this, which can make it really complex because they don't respond the same. So that's what it is. And what we shared last night in our course is a lot of update on pathophysiology. So I'm going to introduce you to our pie chart here. Super love the pie chart. And what this breaks down in functional movement disorder pathophysiology are the different areas of research that have shown as underlying factors or contributors to a functional movement disorder. So the categories, let's start right here at motor control because it's really one of the biggest. Motor control, sensory, psychosocial, lifestyle, autonomic, and physical limitations as contributing factors. What's important to know is that a lot of people in the misunderstanding of this comes from the psychosocial portion, because back in the day, before we could really study the pathophysiology with things like functional MRI or electrophysiology, this was thought to be entirely psychosocial. So that piece of the pie was 100%. since that time, so that started back in like the 1800s, of hysteria or conversion disorder or psychogenic disorder. Since that time, technology has evolved and we've been able to better understand this disorder that is very complex and has a lot of pieces contributing, and it's not all psychosocial. Now, can that be a big piece? Absolutely. Absolutely. And it's something that we need to screen for and include in treatment, but it's not the whole picture. So some of the things, and by the way, I know there's a lot in this pie chart, and I won't go through every single study, but there is research to support all of these areas involved. Autonomic is a big growing area. We see people with functional movement disorders having low heart rate variability or an increased resting heart rate, a hyperactive startle response, and increased arousal, generally speaking. So when we think about this from the pathophysiology, this is why I love all this science, is it directly leads us to the assessment and treatment. This means we need to assess the autonomic nervous system and then also treat it from that standpoint. So that's just one example. A couple of other areas that really have grown in understanding are the motor control and sensory areas. There's been research just in the past couple of years to demonstrate that there can be a difficulty with shifting sets, so shifting between two different tasks, for example, and adapting to changes in a task. So there was a really cool study in our Instagram. You can see it from Wednesday this week, where I talked about a study where they did this broken escalator phenomena. So you'll have to check that out. It points to this underlying issue of motor control. A lot of the research with functional MRI shows changes in where different areas of the brain. So abnormal activation in the supplementary motor area, that area that helps us prepare for movement. Decreased activation in the right temporal parietal junction, which is an area that provides feed-forward signaling and self-agency. Increased activity in the cingulate gyrus, which is an area implicated in self-monitoring and motor inhibition. So if there's increased activation there, that may be part of a functional paralysis, for example. So all of this has just come out in the last couple of years and built on a body of knowledge in functional imaging. And then finally, in the sensory realm, we're seeing that people may have a history of abnormal sensory processing. So this is something that we should screen for. Decreased sensory attenuation as well. And this is an area I think that as therapists, we tend to not be as comfortable with. Yes, screening if somebody has a sensory lesion, or if somebody has like a deficit in proprioception or light touch sensation, but those higher order sensations are really what we see as deficit in a functional movement disorder. So we take this pie chart, and then you would want to have assessment in all of these areas and literally start treatment in the area that has the biggest contribution, right? So if that biggest contribution is in motor control, that's where we start. If it's in autonomic, that's where we start, and it's based on what we test for that person. Okay, so now I want to share with you one more slide going into treatment, and that's the river runneth over slide. And this is, by the way, this is a handout that you can download. This is a couple of pages from our functional movement disorders workbook that we use. And on the left is the river runneth over, and the second side, you see a little bit of the software problem and the understanding your symptoms pie chart. But I'm going to talk about the river runneth over because it's my favorite. And this is one that Chelsea Richardson and Mike Studer created when we did a CSM course together last year on functional movement disorder. And with the river, so if you imagine your nervous system as a river, and this is really helpful for that neuroplasticity optimization and autonomic nervous system. So your nervous system has so much capacity, right? So there's the river is only so wide, and many things can rain and add water to that river. So stress, fatigue, trauma, sleep deprivation, physical injuries, having infection, all of those contribute to our nervous system. And at some point, it can overflow. And I think we've seen this a lot in the pandemic because we're getting a lot raining down on us. And that overflow can look like the tremor or the myoclonus or the gait changes or the weakness even. And what we see along the side are some sandbags. So this is our role as healthcare providers and therapists. Is rehabilitation allows the person to acquire and place some sandbags and literally build up their riverbanks to prevent flooding. It also helps people identify the source of the rain, and maybe that's an environmental factor that can change. Sometimes you have no control over that, right? So you do have control for your sandbags. So we identify those things in the autonomic realm, in the motor control realm, in sensory, in lifestyle, and psychosocial. Maybe it's sleep hygiene. Maybe it's a diet change. Maybe it's having a lot of grounding and autonomic resources. Whatever it is, this is our role as therapists, is to discover with the person those sandbags and help them build those sandbags. And it has been so powerful, so very powerful as a treatment tool, as an education tool for people with FMD. And this is one of the ones that Chelsea shared in a great case that she shared last night. This year, we've done this before, but we more formally launched it this year. We launched an intensive program for people with functional movement disorders, where 4 weeks, daily physical therapy, occupational therapy, neuropsychology, exercise, and exceptional results with this type of intensity for people. And Chelsea presented a case of a person who couldn't walk or was walking with crutches with a very abnormal movement pattern to getting back to hiking. It was phenomenal. In a month, getting back like 3 or 4 years of her life. So a lot of hope for recovery for people with functional movement disorders, and especially with this approach, looking at all the contributing factors. So it was great. I love this topic. I love researching it. I love learning. And I love being able to share this with other therapists and with the people who have these disorders that have unfortunately been very misunderstood in the medical world. So I hope you found this very helpful. I will share a couple of links for you. So I can share a link to our River Runneth Over. We also have free webinars on functional movement disorders. Like, we're very passionate about sharing this stuff. So if you're on our email list, every Friday I send out a link to this video, and then I also will send out resources. So articles and links to our free webinars. So sign up for our education email list, and you will get all of those things every single Friday. So once again, thank you so much for joining me today. I so appreciate it. And I will see you next week. Have a great day.